Strawberry findings in different conditions. Welcome to today's class, where we'll explore the fascinating clinical concept of strawberry appearances in various medical conditions. These unique findings serve as important diagnostic clues, so let's break them down one by one. Let's start with strawberry tongue, which refers to a tongue that appears bright red with prominent papillae resembling the surface of a strawberry. This occurs due to inflammation and desquamation of the tongue's mucosa, exposing the underlying papillae. Strawberry tongue is commonly seen in three conditions. The first is scarlet fever, caused by toxins from group A streptococcus. Initially, there is a white coating on the tongue that later peels off, revealing the characteristic red appearance. Patients with scarlet fever may also present with a sandpaper-like rash. The second condition is Kawasaki disease, an acute vasculitis seen in children under 5 years. Along with strawberry tongue, these patients have persistent fever, conjunctival injection, rash, and swollen lymph nodes. Untreated cases may develop coronary artery aneurysms. Finally, toxic shock syndrome, caused by toxin-producing strains of Staphylococcus aureus, presents with high fever, hypotension, multi-organ failure, and strawberry tongue as a clinical clue. Next, we have strawberry cervix, which describes a cervix that appears diffusely red with small punctate hemorrhages, giving it a strawberry-like look. This is typically seen in trichomoniasis, a sexually transmitted infection caused by Trichomonas vaginalis. The intense inflammation of the cervical mucosa leads to the characteristic hemorrhages. On colposcopy, sandy patches and inflamed areas may also be observed. Patients usually present with frothy yellow-green vaginal discharge, itching, and dysuria. Moving on to strawberry gingivitis, this refers to painful, red, and inflamed gums with petechial spots that resemble the surface of a strawberry. It is associated with granulomatosis with polyangiitis, GPA, and autoimmune vasculitis that affects small and medium blood vessels. In addition to gingivitis, GPA patients may experience respiratory symptoms, nasal crusting, or even hematuria. Recognizing strawberry gingivitis is crucial for early diagnosis. Now let's discuss strawberry nasal mass, a red, polypoidal mass in the nasal cavity resembling a strawberry. This is most commonly associated with rhinosporidiosis, a chronic granulomatous infection caused by Rhinosporidium seborrhei. Clinically, patients present with nasal obstruction, epistaxis, or difficulty breathing if the mass becomes large. The strawberry gallbladder presents differently. It describes a yellow speckled mucosa of the gallbladder, resembling a strawberry. This occurs due to cholesterol deposits within macrophages in the gallbladder wall, a condition known as cholesterolosis. While most patients are asymptomatic, some may experience biliary colic. Strawberry hemangioma, on the other hand, is a benign vascular tumor presenting as a red or blue papule or macule. Commonly seen in infants, approximately 10% develop this condition. These lesions grow rapidly during the first year, but usually shrink and disappear by 5 to 10 years of age. Though they rarely cause complications, large hemangiomas may require intervention. Another fascinating finding is the strawberry skull, seen on fetal ultrasound as a skull with a flattened occiput and pointed frontal bones. This is associated with Edwards syndrome, also known as trisomy 18, a chromosomal abnormality. Patients with Edwards syndrome often have severe developmental delays, cardiac defects, and growth restriction, with a poor prognosis. Strawberry lesions in the rectosigmoid region refer to punctate hemorrhagic lesions, typically caused by infections with spirochetes and Bacillus fusiformis. Patients with these lesions may present with abdominal pain, diarrhea, and occasionally rectal bleeding. Finally, strawberry nasal mucosa is characterized by red, inflamed nasal mucosa with a granular appearance resembling a strawberry. It is associated with sarcoidosis, a chronic granulomatous disease that affects multiple organs, including the lungs and nasal cavity. Patients often present with nasal congestion, crusting, and occasional epistaxis. Thank you. Stay tuned for more videos.